Step 48, pregnancy test. So before your egg collection, 2 days before, you do trigger shot using HCG injection, Overdrill or Pregnal. So if you did HCG trigger, that HCG can stay in your blood for 7 days. If you do pregnancy test during this 7-day period, then you will have a false positive pregnancy test. Although it stays for 7 days, in small level of HCG can be detected in your blood or urine even after 7 days. That's why very important not to do pregnancy test too early after the embryo transfer. Essentially, general rule is first 10 days after the embryo transfer, you should not do pregnancy test. So first pregnancy test you should do using blood test 10 days after the embryo transfer. On that pregnancy test, we check two things: HCG levels and progesterone levels. HCG only source on that day for HCG, unless you're having HCG support, only source for HCG is blood center. And if you see any HCG in the blood, which is more than 5 units of HCG, that means the implantation did take place. Really, we want to have more than 100 units of HCG on that day. And we also check progesterone. We really want progesterone levels to be higher than 30. Here you have 3 sources for the progesterone. One is from ovaries. Although you had the egg collection, you may be producing small amount of progesterone from the ovaries, from the corpus luteum of ovaries. Second is from the placenta itself. If you had an implantation, placenta may start producing a small amount of progesterone. And third is the progesterone you are giving yourself vaginally or intramuscularly. So then you repeat HCG after 48 hours. Generally, you want to have a doubling of HCG. There is a variation in HCG levels and a variation in increase in HCG levels. It may not double in all patients. Provided you are getting more than 60% increase between these HCG measurements and HCG levels, that's also considered normal. So if it didn't quite double, you may need to repeat again after 48 hours. Really, generally, approximately it should be doubling after 2-3 measurements and every 48 hours. And also your progesterone should stay higher than 30. If that's the case, then you continue your progesterone support. Then you do ultrasound scan at 7 weeks of gestation, which is approximately 4 weeks after embryo transfer. Then your fertility specialist will decide whether you can stop the progesterone or you should continue the progesterone.